And we have a lot to get to with Dr. Zach Levine, of course, ER physician at the MUHC, of course, BT regular, our in-house doctor. Dr. Zach, thank you so much for joining us this morning.
Thank you. Good to be here.
It is Blue Monday, so it's this day of the year that's supposed to, for a bunch of different factors, be the most depressing day of the year. A bit of a media story. But we brought you back on the show to talk about something very serious that I went through, a lot of women go through. We don't talk about it enough. We were talking about postpartum depression. Yeah. I was honest on the show. I was dealing with my mother passing away, so mourning that and going through postpartum. So first of all, Dr. Zach, what is postpartum depression? What does that mean exactly?
Well, it's first of all, I'm really happy to talk about any mental health issue because the more we talk about it, the more it's normalized. People realize it's out there, so I'm always happy. And postpartum depression is quite normal in a sense. In fact, the majority of women after they deliver have what we call baby blues, which is basically a mild form of depression, but that's only temporary. Postpartum depression, to actually get that name, lasts longer. So basically it lasts more than 2 weeks. It's any time within the first year after delivering a baby. And it's a severe depression, basically.
Okay, so you did mention baby blues, and which you said is normal. So what happens to our bodies after we have a baby that are hormones drop? What's happening to us?
There's a major drop in hormones, especially hormones like estrogen, like the neurotransmitters in our brain that basically control mood. Basically, there's a very high upswing during pregnancy, and then suddenly, with delivery, there's a huge drop. And so in addition to all the major changes, as you know, like the major changes that happen, the real changes, your life is...
Lack of sleep.
Yeah, lack of sleep. You don't have any control, right?
I call the first 3 months the fog of war. My husband and I were stabbing blindly in the dark trying to figure it out. But so there's life changes, but then hormonally what's happening? Yeah,
there's a massive decrease in hormones that your body has become used to over the past several months. And so that is a biological cause for a change in your mood. And in many people, in a majority of people, the symptoms of depression. And in some people, it lasts a long time, and it can be very, very severe. There's postpartum depression, but then there can be postpartum other mental health issues related to postpartum status also.
Okay, let's talk about those things. So you said anything that lasts more than 2 weeks within the first year, so more than 2 weeks within the first year after you've delivered can fall into a postpartum category, and there's many different categories. So what are some of the signs that women and their partners should be looking at in terms of, okay, this is more than just quote-unquote the baby blues, I am now feeling overwhelmed. What are we looking at for signs?
Well, there's two things. First of all, with the baby blues, it's interspersed, right? So people are down some of the time, but they're also up some of the time. It's a difficult time for everyone, especially a first-time mother. Like, it's a crazy time.
I can attest to that. So from baby blues to postpartum, what are we looking for?
So the difference is, first of all, it's more constant. So it's the symptoms of depression. So one is you're just feeling down, depressed, sad all the time, crying, unable to concentrate, not sleeping well. Appetite changes, so basically some people eat more, some people eat less. So some people have no appetite, some people are emotional eaters, so they just eat all the time to try and feel better. They're not able to enjoy themselves. Like I said, they cry a lot of the time. And then the major ones that I mentioned are appetite and sleep and mood, of course. And often there's anxiety and guilt as well associated with it.
Okay, and I do want to talk about this, and a lot of women don't talk about this, is that there is a feeling, I didn't go through this one feeling personally, but I do remember feeling overwhelmed and thinking, oh my God, my husband and my baby would be better off. Like, they could do so much better without me. Like, and a lot of moms have a very strange relationship with their baby and then their partners in that time, and then we feel guilty talking about it and guilty feeling it. What is going on in our brains that's making us feel that particular feeling, which is a very sad place to be in,
right? It's terrible. And there's two things. So number one is it's the neurotransmitters. These are chemicals in our brain that are kind of mysterious, but basically sometimes the thoughts come after the chemicals. You know what I mean? Like, we feel a certain way, and then we attribute a thought to it.
Okay.
So we attribute those thoughts, like what you were saying. The baby.
They don't deserve. They can do so much better than me.
It's really a chemical thing. So you're feeling terrible, and so your brain comes up with these thoughts that are really nonsensical.
But they feel so real in the moment.
You feel terrible, and also there's all these myths that exist that I think don't help, right?
Let's talk about those myths, because women put a lot of pressure on themselves, and we're always trying to do the best we can. Talk to me about these myths.
Yeah. Well, there's these myths that women, I think society in general, have, that basically you're going to have a baby and suddenly you're going to be, first of all, you're going to have this perfect love, you're going to know naturally what to do with this newborn baby. How do you know what to do? Like, this is a weird creature, right?
Yes.
This is newborn
it's a little
creature.
alien in the house.
That can't do anything for itself, right? And at first they can't even respond, right? They don't smile at you, they don't thank you.
It's a bit
obviously.
of a blob. The babies are a bit of a blob in the first few months.
And they're constantly needy. So, but there's these myths that you're going to know right away what to do. You're going to have this endless love. And there's another myth also that your partner is going to be equally involved with the baby, which just isn't the case. Even a very, very involved partner, if you're breastfeeding, for example, can't breastfeed the baby, right?
We're running out of time, but I do want to mention, because you did mention about the partners, and the partners go through a lot of things when you're going through postpartum as well. So I think part of this conversation, the reason we're having this conversation, is so you can both recognize that something is going on, because you have to also take care of your relationship throughout all of this. Dr. Zach isn't going anywhere. He's going to be on Facebook Live, by the way, because we did get a question related to depression, by the way. This is from Jessica Jutras. She says, depression and burnout, what are the differences, or can they overlap? Thank you for discussing mental health. I've gone through depression 10 years ago, and unfortunately there were people who are judgmental or who just don't understand. Today, thanks to media and shows like yours, these difficult issues are being discussed. And then she has Happy Blue Monday, which made us laugh a little bit. Anyway, Dr. Zach will be on Facebook Live, by the way, answering that question, also talking more about postpartum depression. If you've got any questions for him, please send them in. If you're a partner going through all of this, if you're going through all of this, he'll be there. And, of course, more information on our btmontreal.ca website. Dr. Zach has a blog there where he's a wealth of information. That head of his, full. Let's crack it open like a coconut. I'm kidding. We're not going to do that. Thank you so much for joining us. Again, on our Facebook Live. Check that out. Stay tuned. So much more headed your way. You're watching Breakfast Television on City.